All right. Good morning, everyone. Thank you for joining us for our second Equitable Care Committee webinar of the year and our last of this academic year. For those of you whom I haven't met, my name is Dr. Kathleen Kieran, along with Dr. Peter Asante. I'm the co-chair of the Washington chapter of the AAP's Equitable Care Committee, and we are delighted to have two speakers today on rebuilding trust in medicine through courageous conversation. So today I'm going to give you a little bit of a background on our Equitable Care Committee and the toolkit that accompanies it, and then we'll turn it over to our two speakers who will be introduced by Dr. Asante. Okay, here's a picture of the committee. I know in a moment I'm going to show you some of the members, but this is what we look like when we're not just from the neck up, and this is from a retreat that we held about a month ago. And this is over at Children's Village in Yakima. And it was great to meet everybody, see them in person, and be able to do some work. So here we are. That's me and Peter in the middle. And you can see the other members of the team with us, and really terrific team here. Right, and here are our Equitable Care, our Equitable Health Toolkit contributors from 2021. These people, some of them have rotated off of the committee, but these are the people who put together the initial toolkit that we had, which I will talk about in a moment. And we really want to thank them as we continue to revise the toolkit this year. So how did this come about? In 2020, I think we're all aware that our country had a national reckoning on racism. And as part of this, there was a focus on lack of equity in care, which many of us had been aware of for years. But our goal as the Washington chapter of the AAP is to improve the care of children in Washington state, and to do so through improving the experience and education of the children, their providers, and their caregivers, meaning anyone who cares for children. So in 2020, the Equity Work Group, as it was then called, collaborated to establish a toolkit that had the goal of supporting clinics and healthcare providers, particularly in Washington state, but also nationally, in ways that they could provide equitable care, make healthcare more welcoming and responsive to families of color, and delivering high quality care to diverse families and patients we serve in Washington state. And the goal of this toolkit was really not only to identify problems and identify challenges, but to provide initial first steps that people could take both individually and also at the clinic level and the group level to do this work. So there's a current version available for download on our website. There are, I believe, a few limited hard copy kits of the original version of the toolkit available. And then, as I mentioned, we are in the process of revamping the toolkit because it's been a couple of years, and the updated version will be available online as well. This is some data on this that's been provided to over 200 clinics throughout Washington. The online PDF has been shared and referenced throughout our country. And we, as I mentioned, we're really trying to revise this and make this timely, add some content, change the content, update the content to be more relevant to the challenges that providers are facing today. So with that, I'm going to turn this over to the good Dr. Asante, who will lead us through the introductions and then turn it over to our speakers. Thank you.
Well, good morning, everybody. Happy Pride. And I have the privilege of introducing our speakers this morning, Shayla Collins and Dr. Cora Breuner. So for Shayla Collins, she's a devoted wife and mother of two young boys. Both of her children were born with exceptionalities, and she quickly learned that she would have to not only be a fierce advocate for herself and her family, but for all families who are thrust into a multitude of difficult to navigate systems. She works at the University of Washington as a mindfulness facilitator, and also has strong partnerships with several community organizations supporting family engagement. Shayla enjoys reading, eating delicious vegetarian cuisine, and antique shopping. And then our other speakers, Dr. Cora Breuner. She attended medical school in Philadelphia at Jefferson Medical College, followed by a residency in San Diego at the Balboa Naval Hospital. She served as a transitional intern, completing a year's worth of training in both internal medicine and surgery, and then served as general medical officer on the destroyer tender USS Acadia, homeported in San Diego. She entered a 3-year pediatric residency, serving as chief resident in the final year, and then spent the next 2 years as a general pediatrician in Japan, where she volunteered as a pediatric consultant in Navy clinics throughout Japan and Korea, and then spent a year working in Pakistan, caring for Afghan refugees, where she taught soldiers to be medics in their military and local communities. Upon her return from Pakistan in 1991, Dr. Breuner began a 2-year fellowship at Seattle Children's Hospital in adolescent medicine, and then had a 6-year stretch at Swedish Hospital teaching the family medicine residency. And during this time also earned her master's in public health from the University of Washington. She returned to the University of Washington and Seattle Children's Hospital in 2000, joined the faculty of the Orthopedic and Sports Medicine Department in 2007, and currently is a director of the Adolescent Biofeedback Clinic and serves as medical staff president for Seattle Children's Hospital. Her research focus has been on the education of medical students and residents on the integration of complementary medicine into allopathic care, and on the use of yoga as an adjunctive intervention for the treatment of eating disorders and biofeedback for chronic pain disorders. She has many publications and accolades on the safety and efficacy of integrative and holistic medicine. She serves on the Medical Executive Committee for the American Academy of Pediatrics section on integrative medicine. And she has 3 fabulous adult children and a rambunctious golden doodle, loves to travel, hike, and go on adventures. And with that, we turn it over to the two of you for a conversation.
Good morning, everyone.
Hello there.
It
Good
is so
morning,
exciting to
Cora.
be here today. I just wanted to say that I know a lot of you. I see that you in the participant panel, and I'm so grateful to see you. And I'm also really grateful to be with Shayla. I've met her this summer at Lake Chelan at the Washington chapter of the AAP retreat. And when I met her, I was astonished at how incredibly powerful, wonderful, brilliant she was. Even just briefly when I met her, when I heard that we could do this together, I was both excited and a little intimidated because of her lived experience. I just wanted to know more about and wanted to just learn from her and also be taught by her. And the title of this talk, which is Rebuilding Trust, has so many, every word in the title is powerful, which to rebuild, which means something was broken or needed shoring up, which is definitely our medical system and definitely the way we work with our historically underrepresented, marginalized folks that are in our practice that are Black, Indigenous, people of color, whose races, ethnicities, cultures, faiths, backgrounds do not necessarily align with what we are taught to understand, and yet we have to. So the word trust is also big, and a lot of us have issues with trust from our own families, but also in a very broken system, and then medicine, which is a healing art. So, and then finally, courageous conversations means that both Miss Shayla and I and Miss Alexis actually have been working on this for weeks, are showing up today with open hearts and with tender little plants that we're trying to grow with all of you on this webinar.
Thank you, Ms. Cora. The feeling is very mutual. And good morning, everybody. Thank you so much for being here. And also, Ms. Alexis, thank you so much for your guidance with us for the last few weeks in preparing this. And when we look at healing in the medical community, we have to go ahead and acknowledge and accept that there are groups of people who have been historically hurt, and that the fact that there is a lack of trust is real, and that healing will take time, and it will be on their time, those of us who have been hurt. So I'm honored to be here today to have a courageous conversation with you all. Back to you.
Thanks, Ms. Shayla. So we can't start without a land acknowledgement, or we shouldn't start without a land acknowledgement, which is that I live on the traditional land of the first people, the Duwamish. And this acknowledgement, which I've said many times, does not take the place of authentic relationships. So I could just put a slide up here, but that is not what I intend, which is for all of us to take a deeper look at whose land we live. And we need to make sure that we honor those whose land we live on, and also continue to work forward to rebuilding trust through whatever way we can, whether it be through support in our clinics, but also support financially, and just to help pay back the trauma that was suffered by the people whose land we live on. And finally, to acknowledge this country would not exist or prosper if it weren't for the enslaved labor of Black people. We need to honor the legacy of the African diaspora and Black life knowledge and skills stolen due to violence and continued systemic oppression on a daily basis. Thanks.
Alrighty, these are the principles of the 4 agreements of courageous conversation. We ask that you stay engaged, speak your truth, experience discomfort, and expect and accept non-closure. And this is the book, Courageous Conversations About Race by Glenn Singleton, and the principles of his book.
The objective of our talk today is to guide all of you through a case-based format, where we would discuss cases that aren't exactly the cases that we experience, but they're close. So we want to make sure that there's self-awareness and then strength-based strategies. And hopefully you will leave this conversation this morning with some ideas you can take with you today as you go through your practice, whether it's in the clinic or through a Zoom meeting, or even in a conversation with someone who you know and work with. Thanks.
All right, our first case, the vignette we have here is a 10-year-old male comes to clinic for a 2:30 appointment with his mom. They are on time for the appointment, but are told the provider is running late. They have been waiting for this appointment for 16 months to assess for autism. Mom has had to take the day off to come to the appointment. They took 2 buses and the light rail and left the house 3 hours before the appointment. So then there are multiple intake forms, correct, Doc?
Yes.
Mom needs to fill them out before the appointment begins. And here are just a few of them. And so with those forms, can we go back to those for just a moment, Miss Alexis? Thank you. Doc, is there anything you want to say about these forms before I go into my rant?
No, Ms. Shayla, I want you to go into your rant. And this is really important for those in the audience to take a real good look at these forms. I know we use them multiple times a day in our clinic for our patients and families. And until I really talk to you and listen to you, Ms. Shayla, I didn't realize the trauma we were causing to our patients and families by just either handing them these forms or asking them to fill them out through Epic before they come to the appointments. So it's really okay, Ms. Shayla, for you to go for it.
Thank you. It's bright and early, so I'll keep it light. I was telling Dr. Cora that when I first had to fill out the assessment forms for my child to be diagnosed with autism, the forms felt very accusatory. They felt very blaming. And I felt that had it been explained to me that the forms were being used to help better understand what my child's needs are currently, and then what possible services could help support my child as we get to understand those needs, I would have felt a lot less accused, a lot less blamed. And then thinking about when I had to fill out PHQ-9, and particularly question number 3, I was telling Dr. Cora, they were asking about trouble falling asleep or staying asleep. I don't know anything about sleeping too much. I haven't had that issue. When I talked to my own personal doctor about that question, and they said, so how is your sleep? And I straight up told them, I'm Black. I have a Black husband. I have 2 Black sons and 2 Black stepsons. What is sleep? So thinking about how those questions affect the people that you're giving them to, the families that you're engaging with is very important, particularly when you come into the room and we have just had to answer those questions such as how much do you read to your child? Is that in between trying to work 3 jobs, travel on 3 buses, make sure there's food on the table, make sure that they get their nap and their vegetables? Just thinking about when we reflect on the questions, how we feel, and then you all step into the room and use those forms to continue to engage in more conversations. By all means, we know you didn't make those forms, but how we feel after we've had to answer some of these questions, feeling like we're being blamed or accused of our circumstances, is often quite difficult. Thank you.
And thanks, Michelle. I know, I just want to put some perspective on that as well, which is, and again, it is early because I've heard you speak a little more firmly about this.
It's early.
It's okay. It's all right. It's all right. This is when we just like, okay, we listen, which is, wow, every one of these questions, feel that about yourself, that you are a failure, let your family down, or honestly, I don't even know why sometimes I ask these anymore now after you and I've had these conversations, because the perspective can change so much. And I would imagine that at some point, if you were honest and said with nearly every day, right, which is 3, that you would, quote, get in trouble and be considered a bad parent, or suddenly the appointment shifts from the child and the need for a diagnosis to, is it safe to send our kid home with this kid home with you? I can't imagine that how would you not? So you'd have to think a little bit about how to answer these questions and how it would look.
And who's going to read them?
Mhm.
If I told you where I was genuinely coming from, particularly as it pertained to my mental health at that time, how would you then perceive me? And then how would we move forward? Who's going to knock on my door, right? It's quite painful.
And then with the, and thank you so much, Michelle. I know this is hard probably even to talk about this now, and I appreciate it. The generalized anxiety disorder scale, GAD-7, it's a little bit covered up by the ASQ, but you all know what I'm talking about. Question number 7, which is feeling afraid something awful might happen. I mean, I'm laughing only because if I don't laugh, I weep. Because, well, I mean, I'll let you answer that, Shayla.
If you're feeling like something awful might happen, you're just trying to figure out which angle it's going to come. You're always waiting for the other shoe to drop. If there's a shoe to drop, you're waiting for something to come at you. In particularly when you're dealing with children with chronic health needs, and then considering your own chronic health need as well.
And thanks, Michelle. I know we're not saying we should take these forms away because they are good screening tools. And I know that we are in a mental health crisis in our country. I know this. Mm-hmm. But I also think from when I listened to Miss Michelle and when I really reflected on it, from getting to know her better, hearing her perspective, I realized, wow, I need to be really mindful of what's going on here. And use these forms in a much more compassionate way and understand that who's getting these forms might be traumatized just filling them out.
Thank you.
And I think, Miss Alexis, we can go to we can go to the next. Thank you.
All righty. And these are the perspectives that I believe, I'll speak for me. These are the perspectives that I have when I'm preparing for my children's appointments and thinking about concerns around requesting or taking the day off. Those are 2 different things depending on if your employer allows you to take that day off after you request it or not, because these appointments are still going to happen. The pre-appointment anxiety, days preparing for everything, running through it in your head over and over and over about what could go wrong and what may go right. Making childcare arrangements for the other children and how that may or may not affect your partner. If you have a partner, how do you balance this? Because these appointments are so important, particularly using the vignette if you have to have certain modes of transportation that make things a lot more difficult. Then do you have a bus fare or light rail fare? There's been many times in my life that I haven't and I've gotten on there anyway and had to explain to security, I'm about to go where I'm about to go. Okay. However, this is going to happen, it's going to happen. Okay. So thinking about being in that mind frame, and then choosing the most efficient and safest route, if you even have that options. Sometimes the light rail ain't what you want to do. Sometimes a certain bus route is not one you want to hop on, right? So if you have the options, making sure that, especially since you have your child with you, you're able to safely get to your appointment. And then you're thinking about your own health needs, right? A lot of us have children with chronic healthcare needs, and as do we. So how do you balance making sure that you're healthy enough to be able to make that appointment for your baby? And then explaining the change of routine for the child. You're going to miss school. No, we might not be able to sit at the breakfast table for an hour today. We might have to have our bath tonight instead of in the morning. Just making sure that they understand that things are going to be different so that we can make it to your provider. Addressing questions or concerns from your previous visit. Often I've left the doctor and they said, well, look out for this. If you don't see this in 90 days, or if this is happening, let me know. And so after you all go over your electronic health record, we revisit those questions, and it's up to me to be able to have captured that data in some form or fashion to be able to let you know how things have went. And then there's questions or documentation needed from this visit. Sometimes you need something for school, something related to the IEP, or something related to the nurse's office. It's often easier for me as a parent to bring that form to you than it is to have you all communicating back and forth with the school, because sometimes things get lost in translation, but you have to make sure you remember to bring that. And then I'm going to go with, most importantly, I have to make sure I pack us a lunch. If I have a 2 or 3 hour bus ride one way, it's a 2 or 3 hour bus ride the other way. We're going to be hungry, and I might not have the means to be able to share, I might not have the means to be able to buy those snacks. I might not be able to make a stop. So I have to make sure that I come self-sufficient. And this is all before I've even stepped in to see you, to fill out the questionnaire, and then to see your face. And so holding it together under these circumstances is it's often quite a feat. Thank you. Back to you, Ms. Cora.
Thanks, Ms. Shayla. So yes, this is, as again, the perspectives from the provider's standpoint, there's this sort of blissful, not understood disacknowledgement that this person who we're about ready to see has what they've gone through just to see us, and how much time it took for this appointment, which would, let's just say it's a hour appointment. And as you might remember, this provider is running late. So to the provider, they're running late. Let's just say they're running late because of what I said there, that the patient had to, the doctor had to get their own child to an appointment and run through things with their oncology clinic appointment, and felt terrible about both the fact that their child was going to therapy and they were going to an oncology appointment, and then had to show up to late for a clinic that was running far, sometimes behind. Let's just say there was a float medical assistant. Things just weren't running smoothly. So the provider brings in their own perspective that they felt not present for many reasons: personal, family, the clinic wasn't running smoothly. And they actually knew. I would have known this. I'm not on my game right now, and I'm not showing up, and I'm feeling bad about myself. And so these are perspectives that the patient may not know, because the provider isn't supposed to tell the patient anything, right? It's just supposed to be, we are automatons without any of our own stuff, but we do have it. And so I think one of the things that Michelle and I have been talking about, which is how do we meet somewhere in the middle so that there is a conversation, so that everybody is on the same page about what is going on. Next slide.
So as providers, we're just going to ask you to quickly reflect on how do you feel when you entered the room in this situation, or when you enter a room in a similar situation. What are you bringing with you when you enter into the room? And how does that affect your engagement? Also think about how could things have gone differently in your engagement with that family, and how could they have gone better? What can we do next time to improve our engagement with the family? And what did you learn from this vignette, or what did you learn from your own personal experience? And what did you learn from the family? Because these relationships should be reciprocal. We're learning and growing with each other. And how do we continue to improve? Next slide, please. Okay. So again, as you reflect on the perspectives of both the provider and the parent, think of how you would have handled that situation. What would you have done differently? Dr. Cora and I discussed that it's okay to tell a person, a patient, a family, why you're running late. And the example that we were using is you come in late because there was another family that had to be worked in. If you share that with the next family, that we worked in another family because so-and-so was having an asthmatic attack or something, we as family members often understand that because we have been the family and the patient that you worked in before. But to not say anything to us, which often happens, that creates some issues there. So just talk to us and let us know, hey, I'm running late. This family needed some help. I see you, and I'll get right to you. And that makes me feel like you'll give me the same level of care. And so thinking about the next case that we're going to have, I want you to recall a time where the next vignette that we're going to share, you were in that situation. Or imagine that you as a provider were in this situation. Thank you, Miss Alexis. Think about that. And then also put yourself in the family shoes. How would you feel if this was you and your loved one being treated this way? Back to you, Doc.
Thanks, Ms. Shayla. And this one, I'm actually going to put myself out there. And this actually did happen to me. So this is something that happened a number of years ago. And I think about it every single day and feel really horrible about it. And it has formed and reformed my passion for this work and working through my own, just trying to be a better person and better healer and better listener. So I was on call. It was a Friday, and I was asked earlier in the day to see a patient who was admitted that was about ready to get discharged for chronic pain. And I was hopping over there to the hospital to see the patient, to see if they wanted to do biofeedback in my biofeedback program. Had a long day in clinic, and I'd been called multiple times in the day about when you coming, and hadn't really been given any backstory as to what was going on, just like when are you coming? So, and that was really on me. I should have been, what is the situation? Why urgency? I really do have a full clinic panel here today. Can you explain to this family what's going on? And they said, yes. And I'm not sure it happened. Anyway, I went over to the hospital and I had my coat on. I had my backpack was on. I was clearly rushing in and really didn't even have the respect to sit down. Actually, I just stood there, didn't bother to like listen really. I just explained that I only was hopping in for a minute, and because my own needs were clearly what was perceived and probably what I thought superseded who I was seeing. And both of the parents, when I walked in the room, were pretty upset, frustrated, and been waiting all day to see you. And both had taken the day off work and were really worried about their child, and were being asked to leave the hospital, not really wanting to, based on this one provider who was going to talk about this one intervention that they hadn't really heard anything about and wanted explained to them. And I was dismissive and in a hurry. So I wish I could undo it, but I can't. And so I'm going to present it in a way that I want you all to understand that we are not perfect, we are human, and yet make mistakes on a frequent cadence unless we catch ourselves. So I sat down with the family. I realized, wow, I have absolutely done this terribly. And, but the damage was done, really. And that's where my feelings have lasted for so many years, where they were pretty upset with me and said, well, Dr. Breuner, we actually don't want to do this. We feel disrespected by you and this organization, and we really don't want to do this. And it took me weeks and weeks of talking to them and trying to repair the damage that I had. If I just had stopped, like Shayla was saying, and said, what am I bringing into this room? How could I have done this differently? And honestly, I could have just taken a deep breath and practiced some of the mindfulness skills that Shayla teaches and understood the perspective from the family instead of it's all about me. And it just could have gone so much differently. It wouldn't take much to do that. And that's where, again, I feel very strongly about this. Thanks, Shayla. Thanks, Miss Alexis. So again, when I entered the room, I felt just all the things. And I brought into the room the entire day, all of my privilege, all of my whiteness, all of my education, all of the things that Dr. Peter said about me, all of that. I brought it all in there with me with big, huge luggage bags of privilege and power. And I didn't need to bring any of that in there. It could have gone differently if I just had left all of that at baggage claim, I guess, and realized, this is okay. I need to call home and tell my family I'm going to be a bit late, which they wouldn't mind. They would just be playing more video games. It's fine, whatever. And I could have been a little more respectful of the time that my family patients were spending waiting for me. And what I learned was was self-forgiveness and some grace, which is I made a mistake and I need to do better. And I need to be honest with my families, and probably should have spent a little more time talking to the team in the hospital and saying, what is going on? Can I call the family now on my lunch break in the middle of the day, or would the family like to go home and me talk to them? There was a lot of things I could have done differently. And I learned, again, checklists, reaching out to the other members of the team and reaching out to the family personally would have been a lot better, and also explaining my situation and my perspective. Thanks.
Thank you, Doc. And that leads us to my absolute favorite quote in the world. The relationship with yourself sets the tone for every other relationship you have. And that is by Robert Holden. And to me, that quote allows you to ask yourself, how are you showing up? How are you showing up for yourself? Okay, you get that, Grace. How are you showing up for your own family? That's absolutely valid. And in this instance here, how are you showing up for your families and your patients and your families, right? Take a moment to check in with your mind, heart, and body. How are you feeling? Because that is exactly how you're showing up, and we can see it and we can feel it. Okay? So take a moment throughout your day to ask yourself that question. I do it all the time, and I'm gonna be honest with you. Sometimes I know I'm showing up wild. I'm showing up crazy. Okay? That's real. But being mindful is asking yourself that question. And then be gentle, but be ready to grow. Okay. Next slide, Miss Alexis. Okay. And then when we are speaking with our patients and engaging with our patients, please know that as families and as patients, we are used to being talked at, talked above, talked to and about and over, okay? But it's often times where we are not being spoken with, right? And in that, I need you all to assume competence. I'm not saying that you don't, but I'm saying there's instances where that has not been done. And that leads me to the questions that I came up with here that hopefully allow you to see things through a lens of curiosity, okay? And the first question being, are you familiar with? That could be a colic, that could be developmental milestones, diaper rash, anything versus do you know? That comes off, it can come off a bit accusatory. So how we frame our questions in order to elicit the answers that we need is very important. And then asking the families, what would you like to know? Why is XYZ important to you? So you can learn more about where the families are coming from with their questions, right? What are they here for? What is the angle? And this one is important too. How do you best receive information? Is it verbally? I'm old school. If it ain't a hard copy, it don't exist. I need some paper printed, right? Taking notes, text messages, voice notes, listening. What works best for me to be able to communicate the information that you need to you, right? And then my personal favorite, what would success look like for you and your family? I'm gonna read that one again. What would success look like for you and your family, given whatever circumstance or instance we are discussing? And that can look different for each family, right? And then are there any unmet needs to getting there? And what can I do to help you get there? Right? That's what I'm here for. I'm a service provider. And again, let me make sure you all understand. I know there are a short amount of times for these visits. I know there's insurance companies and things of all that nature. But when we are sitting in these offices coming to you and we are talking about rebuilding trust, we have to know that you're willing to go that extra mile. We have to know that you're willing to do what it takes to get us to where we want to be and where you want to see us as well. And then that leads into, where can I be most useful? Ever since I was a little girl, my mom used to just holler, be useful. I was 3, I didn't know what she was talking about, but it stuck with me. I'm 100 now, right? Is there anything you'd like to request from me, right? Is that I need you to sign my disability parking placard? Is that I need you to help me get these diapers because the baby's diagnosed with autism? What is it that I can do to help you improve your quality of life? That's why we are here, okay? So please think about, how do we help improve or uplift this family who is coming to you? They're here and they went through hell to get to you. How do we support them? The next slide, please. And before I get to this statement slide, I want to shout out my beautiful cousin, Sharita Brent, in the chat, who says, we need to make sure our things are in layman terms. Okay, we need to make sure that when you're engaging with us, you break it down to us at a level that we can understand. That doesn't mean, in my opinion, you don't share your big terms so that I can learn how to use them both or what they mean. But when you're trying to help me understand what it is we're speaking to, things have to be broken down. So thank you, cousin. And so the statement, I wonder if there is something about XYZ that doesn't fit your lifestyle or routine. That statement I wrote came up because I used to get recommendations from my children's primary care provider and their specialists. And when I would come back to the appointment, I knew I would be preparing to tell them that I might not have met the mark that they wanted me to. But I needed to explain to them, well, I was in a full Crohn's flare. Okay. Oh, my husband switched his shift from day shift to graveyard. So some things might not happen, right? My other baby was in the hospital for a week, so we couldn't get to the, I need you to try to be curious about why maybe I'm not able to do the things that you feel would help our family and that I feel would help our family, but what is the barrier to getting there? That is in that building relationship, right? And then if I ask you a question, I need you to be humble. Okay, I need you to have some humility and say, I don't know the answer to that. but I'll do some research and get back to you, and actually do it. And even if it is your assistant who gets back to them with that information, that's cool. But saying, I don't know, that is okay. We don't expect you to know everything, but we expect you to engage with us with respect and let us know that I will get back to you with that information. Okay. Now, this is a biggie. And Doctor, I want you to speak to this about the fabulous cast example that you gave that I didn't know about when we first talked. If I ask you for something and you tell me no, no, I can't do that. I need you to tell me why. I need you to know why you're not able to do that. Because other than that, I'm thinking you a gatekeeper. But in the example that I want you to share, Doc, that was a hot one. If I need a waterproof cast, Doc, why can't I get one?
All right, thank you, Ms. Shayla. I'm looking at the chat and actually realizing I wish these were the questions that we asked the patient as opposed to, are you sleeping? So this was a situation in orthopedics a couple weeks ago where a very privileged white family had a kid that needed a cast, and they were headed off to Hawaii for a week after the visit with me, and they wanted a waterproof cast for their kid with a broken arm. And we don't have waterproof casts at children's hospitals. Why? Because Medicaid, Apple, Molina does not cover waterproof casts. So we have made a collective decision in our institution that if we can't just get select people can get a waterproof cast if Medicaid doesn't cover it, where everybody gets the same cast material. And I don't know why it doesn't, if the state insurance doesn't cover it. It's absurd. And I've reached out to insurance so many times about this, and they're just, because I said so, which is, wow, I'm so sick of hearing because I said so. But anyway, that's what I heard and hear. And so the family was quite upset when I said, we don't do this. And I'm happy you can go to one of our providers across town who doesn't take state insured patients and have ample waterproof casts, because your insurance will pay for it. And I explained to the family why, because they said, why not? And I said, well, because it's not universally covered, so we're not doing that at our institution, period. And it's not okay, I know that. And so they talked to each other and decided, well, no, that's fine. We'll just get a hefty trash bag and duct tape, and probably just okay not to zip this kid down the big slide anyway, with a waterproof cast. But one of the things that Michelle and I talked about this, which a couple of things. One is that I was really shocked. I really thought this family was going to just storm off and go to another provider, but they actually said, you know what, we're going to stick here. But one of the things Michelle asked me was, wouldn't it have been cool if the family in their privilege had actually gone to their insurer and say, why don't you cover, or why doesn't the state cover, and actually get involved in legislation to shift this? But baby steps. At least the family didn't storm off and actually understood the mission around children's policies. But bigger picture would have been, wow, wouldn't that have been, but at any rate, that's the case. And I was fully transparent with the family about why, as opposed to just, well, that's why. And they thoughtfully thought about it, and it was an interesting conversation. Thanks, Michelle.
Thank you, Doc. That's my point. Now that I know that you're not gatekeeping, I'm not mad at you anymore, right? And now I'm understanding what's going on, and I know who I need to go at to try to get things changed. But had I not gotten that information from you and just accepted it as just something that you said, I would have been upset with you. That would have affected our relationship, and I would not have known where to take that energy and where to tell that story. So it's very important that you give the families the information so that they can make their own decisions, but also empower them to possibly be able to make decisions that affect other families. This is a ripple effect. And then lastly, because we want to make sure we have time for your questions and your comments, if you get feedback about your engagement, if, like Doc said, that somebody let them know that they felt disrespected and not heard and not seen, you need to, again, be humble enough to say, thank you for letting me know your concerns. I'll genuinely consider them. We as a people cannot get to a place where we are above correction, because that correction prepares us for elevation. So if somebody tells you that there's a place that you can improve, you should be grateful and you should be thankful, and you should use that information to elevate yourself so that the next family gets the elevated you. Okay, next slide, and I'll end it here. This is one of my absolute favorite quotes as well, and I hope you all take it to heart. People will forget what you said. People will forget what you did, but people will never forget how you made them feel. And y'all are in the feeling business, and that is by the illustrious Maya Angelou. Thank you all so much for allowing me to be here with you all this morning.
Thank you guys so much for an incredibly honest presentation. And it's just a privilege to hear you both speak. So thank you so much for your time, and for everybody else for attending. It's our Q&A. People feel free to drop your questions in the chat or raise your hand or unmute. Actually, is it okay to stop sharing for a second, Alexa, so I can see the whole group? Awesome. So what questions do people have? I know that there was one that Sarah dropped in, so I was just going to read it for y'all. Given that supporting families and kids' overall well-being is so important, and so important to pursuing health equity, it will be great to hear specific ways to do this, particularly SDOH or mental health screening, really well in manners that are family-centered. And also, isn't asking the parent, caregiver, or teen what it is important to them the best question? So either Dr. Breuner or Ms. Shayla, either one.
Okay, thanks, Ms. Shayla. I'll take it in reverse order. I really like that. What do you want? I start my appointments right now as, what is your goal for the visit? What can I do to help you? What is it I and my team can do to help you and your child today? What are set the expectations, and put that firmly in the patient and family, as opposed to my expectations, which is how I want you to perform for me, so that I don't feel bad if I don't help you. Whatever, it gets all complicated, but and it seems interesting. I know, Michelle, we've talked about this, but it's really it shifts the power dynamic from I'm the almighty, I know everything, to actually you know your child better than I do. And you have literally spent days, weeks, months asking yourself, how can I ask these questions in a way that makes sure my child's needs get met?
Thank you. Those 5 questions are one of about 60 that I have in the notes in my phone about how to better engage with people, because I've taken nonviolent communication because I'm good at violent communication, but I learned that I had to try to tone that one down and figure out a way to engage in a way that I would be received and still get the information that I needed. And so I also come from a background of customer service. I worked at Nordstrom for a long time. And in that position, if the customer wasn't happy, you would lose your job. So you better find a way to be able to elicit the information that you need in a way that is respectful and received. And so seeing that patient, the patients, as you would see yourself or your family, what would you want your provider to know about you? Right? And asking the family, they obviously came to the appointment, right? They're here. How can I help you? That's how I start. How can I help you? What is it you would like from me? Because there's thoughts and questions that they've had that they might not feel necessarily comfortable to ask. But if you start out with, how can I help you? That makes me feel more welcome to tell you what my concerns are, right? And then you tell me yours, and then we figure out a way to hold both of those up and meet in the middle, recognizing that we are both on the same team, but it's how you come at me, right? And I've told Doctor before, there are many clinicians around Seattle, many providers around Seattle, where we both had to step back and say, I'm sorry, my bad for some conversations that we've had, right? You know what? some ego got in front of us, some emotions, things of that nature. But if we're both here about this baby, then we can come back around, right? But it has to take some humility. It takes some vulnerability. As parents, I want you to know 99% of the time, we trust your brilliance. We trust your expertise. We know you went to school for 10,000 years, all right? We know that. What we feel is lacking is your bedside manner. What we feel is lacking is your humility, your humanity and humility. And I worked in the operating room, and that is not saying what you all are doing. And I asked one of the surgeons, did they school the humanity out of you? You can cut a person up to bottom, sew them back up and have them running in 6 weeks, but you're not nice. And how does that engagement affect my care, right? So think about how you are showing up, how you are coming at folks, and how we can best continue to improve the quality of life for this baby and this family.
Dr. Kieran, I'll let you take the next question.
So first, I want to thank both of you because I think I speak for myself and the committee and Peter in saying that we knew this was going to be great, but it was even better than I thought it would be. So thank you. And Shayla, this question is for you in particular. And I was going to ask it anyway, but you've also just kind of led into it. But I am a surgeon. And so many of the communication skills that we learn are very based in primary care. And primary care is longitudinal. You have a relationship with your provider. There's a lot of well-child checks. And so there's a lot of opportunities to have a great ground of health because people are coming and you're saying your baby's doing great, your child's doing great, a lot of positive notes. Conversely, surgical visits, it's absolutely problem-based and you're meeting a person. I'm meeting you, you're meeting me. And they're generally shorter. And the struggle that I see with many of these visits is that I hear many of my colleagues saying, well, people should know what's going on before they get here. They know they're here for X problem. These visits are only 20 minutes long. I would appreciate some patient perspective on this and how from not just a surgical provider, but from a consulting provider perspective, we can take the best parts of visits with primary care and that longitudinal ground of health and translate them over, understanding that the demands are different.
Thank you. And you use some fabulously big words that I might not understand, but I believe I can get to what you're speaking to. That I love that you said some people feel that some of the providers feel that the families and the patients should know what's going on before they get there. I would ask you to ask those providers, when you get to your mechanic, do you know what's going on? Like, let's keep it humble. Let's keep it real. You know what I mean? You are right. I've had a baby who's probably had 32 procedures and surgeries, right? He had a trach at 21 days, a G-tube at 6 months. He's 12 years old now. He has neither. So I've ran with those appointments, right? It is all about the tone that you're engaging with the families. It is all about the body language that you're engaging with the families and giving that family the options to understand when those are available. I'm not saying there are options and all of that for every procedure, but I remember speaking to some of my baby's ENT surgeons. Shout out to Dr. Inglis and Dr. Dahl, just for clarity. And they would let me know at what time, well, we can try this now, or we can postpone this and we can wait and try this. Like, they spoke to me like a human being, and they provided things to me almost like a menu. And I don't mean to oversimplify things, but they allowed me to recognize that through their expertise, they've seen some XYZ done in many, many ways, and that there were ways that they go about it. And then they would also share with me, I would say, if this was your baby on this stretcher, how would you go about it? And then that elicits more conversation. But that's building relationship. And I'm not saying all these relationships been easy. Like I said, there's been 50 million I'm sorry's, right? So speaking to people and seeing the humanity in each of us.
And I'm going to let Harbir take the last one. I know we are at time, so, but we'll take this last one, then we'll wrap up.
Well, I just wanted to thank you both for just such a powerful and thought-provoking talk. Just looking at some of the comments in the chat, I do hope that we can have a space to sort of explore a little bit further what we're doing on the primary care side with our screening questionnaires and how we can do that more thoughtfully than what we're doing right now. Because I think that's what I'm hearing. Like some of the questions that we ask, our intention is one thing, but there's potential harm in how we're asking, and we're not being thoughtful about how we're asking them. And we're giving the same questionnaire to a 10-year-old that we are to a 65-year-old. And we're pediatricians. Why are we okay with that? Why did we let that happen? And then in my Equitable Care Committee team, one of the questions that had really come up with is, let's also be honest about how billing plays into this and how we're being pushed to bill higher codes in certain situations. And that ties in directly to all of this. So I just wanted to thank you all, but also hope that we are able to continue the conversation about that part of the talk today.
Well, thank you. Thanks, Javier. That's such a great comment and a great place to end today. At the end of the day, you know, healthcare is a system, and systems are made of people. Kathleen loves to say that on a regular basis. And remembering that because we are people, we thrive on relationships, and we need to give each other grace in those relationships. I think that at the end of the day, we've been talking a lot about forms and screening in the chat, and certainly having a real conversation about how do we as a system, from the time that a patient gets a call to schedule an appointment until the time that they get into the doctor's office, how are we being intentional about those interactions as opposed to trying to get on and off the phone or in and out of the room quickly. And so this isn't just on us as medical providers. This is on all of us as a system, but we are also in this room advocates of that work. And so hopefully we are able to take this information back to our respective clinic and healthcare groups and start to have real conversations about how are we using this information, how are we asking this information, and how can we better serve our patients such that we don't continue to traumatize them with what we are doing. So with that, thank you all so much for—
And thank you, Peter. I want to make sure I give a huge shout out to the whole team, especially Ms. Alexis. If you could put up the last two slides, just so people can see the resources we have for you to take with you. And I guess this is recorded and it will be available on the Washington chapter site as well as resources. But I just really, really want to thank Ms. Alexis and the team for making sure all of this got together. And mostly I want to make sure that we do a shout out for the equity group as well. And finally, it is an honor and privilege to know Shayla. I'm grateful that she's a colleague and now friend, parent, and just a wonderful, beautiful person. So Shayla, it's just been an honor to present with you. And I think we're going to be doing another one, and we're going to take this one on the road, hopefully.
I'm down. Thank you all. Thank you very much, Doc.
Have a wonderful, wonderful day, everybody. And we will see y'all in September for our next webinar. We hope you guys can join us there when it's on EHR Design Equity. Take care, y'all.